this evening. We will be recording the first half of the event, because that recording will be placed on the Cancer Alliance website. So if you don't want your face to appear with that recording, please turn your cameras off now. The other thing to say is that this will be exactly the same as previous sessions. We have Sarah Sheppard, lead community cancer nurse for the Peterborough Hospital, who will be talking about quite a wide range of side effects, some of which she's seen in the patients that she's managed. And then David Day, who's a member of the patient partnership group, will be talking about the side effects he experienced when he was being treated for bladder cancer. I don't think I said, but I'm Ray Anderson, and I co-chair the patient partnership group. And Jane Parker-Coulson, who's also here, is the patient engagement lead for the Alliance. Now, we don't want to interrupt the speakers in the first half of the meeting. So if you have a question or you wish to make a comment, please use the chat function and type in what you want. And Jane will moderate your questions in the second half of the meeting. The second half of the meeting will not be recorded, so you can put cameras on when you get the nod that that has happened. But I think that's all that I need to tell you at this moment. So I will rapidly now introduce Sarah Sheppard, as I said, lead community cancer nurse at the Peterborough Hospital.
Oh, thank you very much for a warm introduction, Ray. I'm just going to share my screen on here. Okay, can everyone see my slides just there?
Yeah.
And yeah, thank you ever so much, Jane and Ray, for inviting me to come and talk to you all tonight. I've been working in cancer care for 17 years now, and currently the lead community cancer nurse for Peterborough City Hospital. It's a very privileged job. I really enjoy going out to see patients in their own homes to give their cancer treatments and supportive care. And it's in Peterborough in Finland, and it's great to be able to shape that service, because it's a relatively new service as well. So cancer care is rapidly evolving at the moment, and I'm hoping in another 17 years it's going to be completely different. There's going to be a lot more targeted treatments and a lot more individualized treatments. But at the moment,
Sarah, we've just lost your sound. If you could turn your mic back on.
So how much did you miss?
Just the last sentence, I think.
So these are the main type of cancer treatments that we're giving at the moment. So we've got chemotherapy, immunotherapy, hormone therapy, and radiotherapy. So that's what I'm going to be talking to you about tonight. So they can be given individually or in combination. Does it keep on muting? I'm not quite sure.
And she said it's not your fault.
Okay, so first I'll talk about chemotherapy, which is generally the main course of treatment that people will be put on. So this one has the main the majority of the side effects. And if you've been on it before, you'll know about the bone marrow suppression. So we'll always be looking at the white cells and how you'll be more susceptible to infections during that treatment. So we'll always be telling people to keep themselves as healthy as possible, away from infections, avoiding big crowds, and keeping themselves as healthy as possible as well, making sure their vaccinations are up to date as well. That's really important. And then also reporting any signs of infection straight away. You should be given a 24-hour telephone line that you can contact if you've got any concerns. And then you can ring up and get advice of what to do. So signs of infection, of feeling shivery and shaky, a sore throat, a cough, breathlessness, perhaps diarrhea, or needing to pass urine a lot more often than usual. So there's some of the side effects that you can get with having an infection. So we'd advise you to take your temperature regularly, and if it was within a certain level, to call your 24-hour telephone number and get some advice. Also, nausea and vomiting. So when you're put on chemotherapy, you should be given some really good anti-sickness or antiemetics, as they're called. And there's just usually a general one that works, that they put on the standard. But if that's not working, you're taking that regularly and it's still not working, you do need to get back in touch with your prescribing team, and then they can put you on something else that would work better or more effectively, because there's nothing worse than suffering of nausea and especially vomiting. You need to keep yourself your energy levels up as much as possible, and that means, you know, eating regular meals, and you can't do that if you're feeling nauseated. So it's really important to get that sorted from the onset, really. Other things that can help with nausea, perhaps having like ginger biscuits, ginger tea. Some people have told me they've found like ginger granules that you can get from Holland and Barrett that can be quite useful as well. Some people rely on the little bands, like C bands, they wear those. Also, other people can be quite put off by like big meals, so they'll go for eating a little and often, which can be better, because sometimes you just don't fancy eating, but the nausea can come from actual hunger pangs because you're not giving your body the nutrition that it needs. And also that can come into effect also with like sore mouth and indigestion that can come from chemotherapy as well, and it all just really puts you off eating. And the steroids as well that we give you, that can sometimes give you indigestion and issues like that. So if you do get a sore mouth and you're finding it difficult to eat, you can get a mouthwash, just over the counter, non-alcohol one, or sometimes from the hospital they can give you one with a local anaesthetic in it, which can be much better, because then you can have that before food and it can just settle that mouth so that you can have that food and drink. So that kind of covers the loss of appetite as well. Although I was talking to Ray the other day, and he was saying when he had chemotherapy, his appetite increased and he put on weight. So it can go both ways, because the steroids can make you more hungry and want to eat more. But we don't want you to be losing masses of weight, because that is it's really important that we keep you as healthy as possible, so that you have got the energy to be able to get through this difficult time. So the chemotherapy can affect your gastric tract as well. So you may get constipation, which can be a side effect of the anti-sickness. You can get diarrhea, which I've spelled incorrectly, sorry. And so we don't really know how you're going to go when you start off. So it's to be prepared for both options. If you do get constipated, we can give you some laxatives to help with that. Or if you do get diarrhea, we can give you some like Imodium loperamide type medication to stop that. But if you're struggling, if you're having like more than 4 episodes of your normal, more than your normal bowel motion, you should contact the 24-hour telephone number and get some advice. It's really important. A side effect that really affects people's well-being is hair loss. It's a big thing with chemotherapy, and some chemotherapies make you more susceptible to losing your hair. Others, you might just get a little bit of thinning. There's scalp cooling or cold capping you may have heard of, that can be used for some treatments to prevent hair loss. But even that doesn't stop you losing your hair completely. A good result after having scalp cooling is 50% of saving your hair, so you're still expected to lose some of your hair. If you're having a chemotherapy that will cause hair loss, by the time you go back for your second cycle in 3 weeks, you would have lost majority of your hair. Some people find that like to wear a hair net or something like that overnight can help, because then you don't wake up to hair all over your pillow, or getting it cut short beforehand can help as well. We're also looking at skin changes. It's really important to keep your skin well hydrated while having the treatment. So having a nice non-scented moisturizer to keep the skin nice and moist, that can really help and stop the breakdown of any skin problems. And also your nail beds as well, they can become discolored, and you can get sore bits on your hands and stuff. I had a patient tell me the other day he uses a treatment for cracked nipples, like breastfeeding mums use, and he's found that that's the only thing that's helped. So sometimes it's getting tips off patients who've tried everything, and then he was really pleased that he'd found that after all this time that was really helping with him. And then one of the most ongoing issues with chemotherapy is the fatigue. Sometimes it's a cumulative effect of the chemotherapy. For the first couple of cycles you can feel fine, and then as it goes on it takes its toll, and fatigue can be quite wearing. So it's about planning your time, if you're having a day of activity, just plan some rest time in between. Always have like a back out clause, so that if you're having a bad day, and you can just back out of your plans and don't feel pressurized into doing them. If you are still working as well, make sure your manager's aware that you're going to have good days and bad days. Saving energy to do some of the things you really enjoy as well, because it's all very well keeping on top of all the house chores and that kind of thing, but you need to do some things you enjoy too. And if people offer help to do chores and everything like that, accept it. Say yes, and to get people to help out. And also gentle exercise. You may not feel like it, but going out for a walk, gentle exercise will do you the world of good. But be mindful of the sunshine, because you are going to be sensitive to the sun and you'll burn easily on these treatments. So make sure you're wearing a high SPF and a hat, and covering up basically. So I wouldn't worried about that a couple of weeks ago, but now it's been lovely and the sun's been very strong, hasn't it? So we'll go on to the next one. I'll probably go mute again, so I'll just nope, I haven't got mute this time, that's fine. So we're going to talk about immunotherapy. So immunotherapy is more of a recent treatment. So I'm showing a picture of a whole body there, because it can affect any parts of the body, and the more we've been using it, the more we've been finding side effects. And also there's more research going into the longer term side effects as well, because it's a newer drug. We're finding people who are having a brilliant response to it, and it's keeping them alive for a long time, but there can be ongoing issues further on down the line that's being more researched. Generally with immunotherapy, you'll start having problems straight away if you are going to. Some people are like a dream on immunotherapy and don't have any issues, but people who do have problems tend to have them straight away in the first few cycles. And other people just can go on and on and on and not have really any issues, whereas chemotherapy quite often accumulates over time and you get more problems as you go on later. So the skin irritations, you can get the rashes and problems like that. So again, we're talking about skin, just really good moisturizing, using a high SPF and avoiding extremes of temperature as well. So sometimes it can cause digestive system irritation. So like extremes of diarrhea, which is colitis basically, and then also lung irritations. So this is where your body's going into overdrive, and it's causing lots of issues. And colitis and pneumonitis are the really key ones that we look out for, that we need to know about. So if you're on immunotherapy and you're having lots of diarrhea or lung problems and lots of coughing, we need to get on top of that sooner rather than later. I know some patients that I've encountered before have been reluctant to tell us about any side effects. They're so keen to stay on this treatment and they don't want to be taken off it, but it's really important. And the main treatment for colitis and pneumonitis is steroids, so it can be treated with steroids, and then hopefully we can get you back on the treatment and then be on it long term, or for as long as you need to be. But it's really important we get onto it sooner rather than later, because we don't want to get to a point where we can't continue with the treatment and you have to be taken off it. So also kidney inflammation it can cause. If you're having problems urinating, that can be because of the kidneys. Heart issues, so we're looking at any signs of breathlessness, swollen ankles and dizziness. Some immunotherapies will do an ECG for, or will do like a heart trace, or an echo, which is a heart ultrasound. So you'll have different follow-ups for that, but we'll keep an eye. Yeah, just some treatments can be a little bit toxic to the heart, so we'll keep a close eye on that. And then blood test wise, we will be checking your liver and your kidneys, and also your thyroid level, just to make sure the immunotherapy is not affecting that. And then if it does, you could be started on treatment. Medication if it's low, and looking at your blood sugars as well, especially if you're diabetic, and to start off with, then it can make your blood sugars a lot higher, but that would be monitored as well. So yeah, like I said, long-term side effects, more looking into, and you'll be followed up. Sometimes the side effects can be like 6 months, a year on, or something like that from finishing treatment. So if you finish your immunotherapy and you start having problems, it would be worth going back to your the team and just saying, is this because of the treatment I was on? Because sometimes it can be. Just have a look at the time. Are we doing okay? And then we're looking at hormone treatments. So mainly hormone treatments given to breast cancer and prostate cancer patients. So I've included a few pictures of goserelin and tamoxifen and the bicalculate as well that some patients are on. So hormone therapy is mainly the fatigue that starts it off with that one. Lots of patients reported to me that, yeah, just lack of energy. Sometimes it can be made worse when you first start on it, and then it can be better afterwards. Headaches and nausea, but not so much of those. Definitely muscle pains and joint aches. I find that can be because of the decrease in the estrogen levels that can cause that in the women. Lots of people report the hot flushes, unfortunately. So there's lots of ways that we can try and do something about that. So lots of people say to recommend doing a hot flush diary, so writing down when you have the hot flushes and what you were doing before then, and sometimes that can give you an idea of what's causing it. So perhaps you've had like a strong coffee from a coffee shop and that's caused it, or perhaps you were quite stressed that day, or alcohol, or something you ate as well. So then you can find out what's causing it. Other things to do is choose dressing layers, so you can like take clothes off and put them on accordingly, using natural fabrics such as cotton with your clothes and bed sheets, not the synthetics. And layering up your bedding as well, so they're easy to take off at night. And keeping your room cool as well, using a fan if necessary. Drinking less alcohol and caffeine, and trying to stop smoking if that's possible, and losing weight if possible. And also some places do acupuncture, because I know at Hinchinbrook and Peterborough they offer acupuncture for hot flushes, which some people find really beneficial. And then we're looking at the lowered sex drive because of the hormone therapy, and sexual effects as well, so erectile dysfunction and vaginal dryness. So this is all something that the hormone therapy can cause, but there's usually something we can do about it. So please tell your prescribing consultant and they can make the necessary referrals. There's a place that the NHS can refer to called iMedicare that can deal with sexual dysfunction in men, which is really important. And then we're also going to look at osteoporosis, which is the bone thinning. So some people get put on medication to try and prevent that, such as zoledronic or alendronic acid. Okay, and then we're just going to go on to radiotherapy as well. So radiotherapy is given for many different cancers, and fatigue as well. It can cause problems of eating and drinking, depending on where the radiotherapy was given to, nausea and vomiting, so you'll find you're often put on an anti-sickness. Skin reactions, which can just be a small reaction to a or leading to like a full-on well, I wouldn't say a burn, but it's a bit like a burn or abrasion. Your bloods will be monitored as well, because it could affect your bloods, making you anemic, and fertility issues as well, which should always be talked to you before you start having treatment. Problems of eating and drinking, if you are having problems with that and you're experiencing weight loss, you can be prescribed, you can be referred to a dietitian to help with that. And also sometimes the cancer wellbeing services or that kind of thing can give you some advice and some information leaflets on how you can try and prevent that, because we don't want you losing lots of weight. And so concerns about side effects, and there's so many. Sometimes you can get bogged down with all the information when starting a new treatment. So it is really scary, because we have to tell you about all eventualities, but sometimes it's just, there's no such thing as a silly question. We'd rather you just call the 24-hour line and say, oh, I'm a bit worried about this, and then they can just give you some advice, rather than you worrying and stressing about it at home or things escalating. So please call us, or call your 24-hour telephone number if you want some advice. Talk about any concerns with your prescribing team, if to your consultant or specialist nurse. It's really important that you tell them what's going on, and then they don't necessarily have to take you off the medication, but they can adjust the dose or give you some other medications to make things easier, or change your medication completely if you're really struggling with it. And mental well-being is very important too, so please speak to someone if you're struggling. I've put Macmillan and Maggie's up there, because I know we're covering the whole of the Eastern Cancer Alliance, so I don't know if there's Maggie's around or not, but I know there's HCCN down in Huntingdon, and Macmillan up in Peterborough, Cancer Wellbeing Service. You might find a local support group in your area, which will be really beneficial. And yeah, you're not alone, basically. There's lots of people going through it, and it's definitely worth talking to other people. So now I'm going to hand over to David Day. He is going to talk about his BCG treatment. And David, can you please tell us about your treatment and its side effects? And I'll stop sharing. Stop sharing.
Hi, hi everybody. My name's David Day, as Sarah's just mentioned and Ray did earlier. Just to let you know, my journey started in 2013, 2014. I was diagnosed with high-grade G2P bladder cancer. I had a single tumour which was removed quite successfully, and I then started to go on to my options, which were BCG, remove the bladder altogether, and a couple of other options, which one of them was don't do anything, which I wasn't going to do. So with my consultant and my wife, we decided that BCG was my best form of treatment. I'm not sure if everybody knows what BCG is. BCG is infused into your bladder directly, both for male and female, for doing BCG. And the BCG treatment is, if you remember way back in your school days, you got a little jab in your arm to see if you had TB or not. Well, it's the same serum that they use for that as they put into your bladder, as it was found that it was a good treatment for bladder cancer. As I said, my journey started in 2013, 2014. I started BCG a 6-week dose, which is classed as a maintenance dose. So every week you go in and you get this serum pumped into your bladder. You have to keep it in there as long as you can on that day, and be very careful, because it's a very toxic chemical, so you have to be very careful. Once urinating in the toilet, you've got to disinfect it all and clean it all out before anybody else can go in there. So I had 6 of these with fairly little side effects at that particular point. I do, however, say that the side effects over the 6 weeks, it was a bit like having a cold for a few days, with a little bit of blood and weeing through broken glass, basically. So once I'd got over the 6 weeks and I had a cystoscopy to see if it was all working well, they then put me on another course of BCG. So then I had to start BCG again every 3 months, 3 times, once a week for 3 weeks. And that was when the side effects really started to take hold. Each time I had one of those, it took a longer period of time to get over the side effects. There was not just the pain, the bleeding. There was going to the toilet practically every 20 minutes, day and night, because of the actual treatment itself. What it does is take a lining of your bladder away. So a bit like ladies' menstruation period, it takes the lining off of that. It's allegedly, well, it's supposed to stop anything attaching itself again to your bladder. So I continued to have these 3 monthly sessions. I did up to 27 doses of this BCG. And as you can imagine, that once I started to get the side effects, those took longer and longer and longer to get over. So we had to delay some of the treatment to get, so that I could get over the treatment, get over the pain, etc. It was taken, the 27 doses were taken over 2014 to 2017. In 2015, the side effects, again, it's the same thing. You pain, weeing through glass, if you like to explain it that way. I had to go to A&E a few times. I used to stand at the toilet and just stand and shake. I could not actually wee. It was so painful. And I had to go to A&E. They used to fill me with fluids so that they would make me go for a wee. It was absolutely horrendous at some point, at one of the points. I got through 2015. The side effects were so bad I had to retire from work. I couldn't, the company wouldn't want me, well, I didn't want the company to have to not allow me on the books, where I couldn't go to work and they were paying my salary, etc. So I decided to retire. I was 65, so I was at retirement age. I will say that once I got through all of this 27 and everything else, I did go back to work again. I did lots of traveling, including going to New Zealand, Australia. So there is a light at the end of the tunnel. I did in 2017 see my cancer nurse, and spoke to her about how the side effects were affecting me, because I'd actually, after I spoke to her and we decided that we were going to stop the BCG, I then spent 2 months bedridden. Just before Christmas and over Christmas, I couldn't get out of bed. I was in so much pain. I lost a lot of weight. I went from 34 waist to 28 waist. I wish I was still there today at 28 waist, but I'm not. Gone back to a normal life. So in 2017, as I said, I stopped. I had this few months of being in bed, been to A&E a few times, called out emergency doctors because of the pain, went on to Tramadol. And I also went on, thanks to my daughter, who used to use this because she used to get lots of, with the BCG, you get lots of spasms, very painful spasms. So she suggested that I use Buscopan, which I did use Buscopan. And over about 3 months, slowly but surely, the pain eased off, the spasms eased off, and I went back to a normal life without any pain. I had lots of help from Fight Bladder Cancer charity, who I'm heavily involved with. They've got lots of information that they pass out along, similar to Macmillan and Maggie's and all of those. So I then was absolutely fine up until February, March last year, when I had my annual cystoscopy and they found some more cancer cells in my bladder. So I've now been through a 6 weeks course of mitomycin, which is a similar one, but not as aggressive. With mitomycin, I had no side effects whatsoever. But about 3 weeks later, I had a very severe UTI, which I went to my doctors with, my GP. They didn't prescribe anything. Excuse me. I had to then have a cystoscopy to check whether everything's okay. They found another red patch in there, so I had to then 2 weeks ago I had to have a biopsy, which I am now waiting the results of to see if the mitomycin is on.
I've forgotten about it. Oh, is it ready? It's ready now. You choose. I'll have mine in a minute. Right, okay.
Could non-speakers please mute their microphones? It's causing interference.
Yeah, so I'm currently waiting for the results of the biopsy and to see what the next course of action is going to be. I don't know what that will be. It might be more BCG, it might be more mitomycin, it might be removal of the bladder. But at the moment, I feel absolutely fine. I've just finished 18 holes of golf this afternoon, so I'm now back living my life. And that's my story at the moment.
Thank you very much, David and Sarah, for your insights into this issue. We are now going to stop recording, and Jane will start going through the questions and comments which you put in the chat. Slightly